Okay, so today what we're going to do is the mock checkoff that's going to be for medication administration. The first thing you want to do when you come in, you want to verify your patient information and you want to look at the patient's orders and you want to get to the MAR to make sure that everything matches. So that's the first thing I'm going to do. I have Mr. Holmes, I have his date of birth, and I have his medical record number. All that is correct. I have his allergies, which is the penicillin. His admitting diagnosis was hypertension, and he belongs to Dr. Friendly. As I'm looking at the medications also to make for sure I have the correct medication. So on here I have that he's supposed to get iron 65 milligrams by mouth daily. On here it says iron 65 milligrams by mouth daily, as well as on my MAR. So this checked out. I have Lasix 20 milligrams. However, I do see a discrepancy. On the doctor's orders, it says 40 milligrams, but on the MAR it says 20. So I'm going to set it to the side because I need to call and get clarification. My next medication that I'm going to give is Ativan 1 milligram by mouth daily. Ativan 1 milligram by mouth daily. Ativan 1 milligram by mouth daily. So that checks out to the side. My next medication that I'm going to give is a multivitamin. And on here I have a multivitamin PO daily. Multivitamin PO daily. And I'm going to set this to the side. These are all of my 9 o'clock medications. And my next medication I'm going to give is K-Flex, which is his antibiotic. It says K-Flex 250 milligrams PO daily, and K-Flex 250 milligrams PO daily. So those medication checks out. Next, my patient also has an order for Rocephin to be given IM. So I have my Rocephin that's here, and I'm going to have to do my drug calculation. But on my order, it says Rocephin 4 grams daily times 2 doses. And on my MAR, it also says the same thing, Rocephin 4 grams to be given daily times 2 doses. So my Rocephin has checked out, so I'm going to set it to the side. Next, I also have insulin that I need to give my patient. So in here, I need to give NPH 14 units sub-Q before breakfast, and I need to give regular insulin 6 units sub-Q with each meal. And I need to base this on my client's sliding scale. So yes, my client is going to get all units of insulin, which will be a total of 20 units, because the patient's blood sugar based on the sliding scale was 301, which requires 6 units of regular insulin along with his 14 units of NPH. So I have that, so that's checked off. So now I'm going to call the doctor, and I've called the doctor, and Dr. Manny, I'm calling because your patient's information on the doctor's order says he needs Lasix 40 milligrams PO daily, but on the MAR it says to 20, and I'm calling to clarify the order.
Thank you for calling. Let's do the 40 milligrams that's on my order, please.
Okay, and you're going to correct my MAR correct for me, right?
Yes, I will.
Thank you. So I've talked to Dr. Manning. Dr. Manning wants the patient to go ahead and get 40. So I'm already pulling the extra dose. So I have 40 of Lasix that I'm going to give the patient. So I have checked my MAR and I have checked my doctor's orders. Now I'm ready to proceed. So I'm going to go in. I'm going to wash my hands. Good morning, Mr. Holmes. My name's Alicia. I'm your nurse on today. I'm here to give you your morning medicines. Can you tell me your name and your date of birth? And I'm going to check his armband, and it does says Mr. Holmes, date of birth 1/26/2001, and he does have allergies to penicillin. Mr. Holmes, are you experiencing any kind of pain this morning? He says no, that he slept well. So now I'm going to go ahead and get his morning medicines together. So Mr. Holmes, this morning what I have to give you, I have to give you iron 65 milligrams to be given PO. I also have Ativan 1 milligram to be given to you PO. I have Lasix. The doctor changed your order from the 20 on yesterday to 40, so we're going to give 40 on today. I have your multivitamin that I need to give you, and I need to give you your K-Flex, which is your antibiotic. Also, since your blood sugar was 301 this morning, it's going to require me to give you 6 units of regular insulin along with your regular of 14 of NPH, will be a total of 20 units of insulin. And your Rocephin that I'm going to give you is going to be 4 grams. Is all this medication okay with you to give today? And he said yes, so I'm going to prepare the medication. So I have my medication. I'm going to put it in the cup. So the first thing that I'm going to give him is going to be his insulin. So we're going to get our gloves. He is taking his PO medications fine without any problems. So I have my regular that's here, and I have my NPH. And as you can see, the NPH is cloudy at the bottom, so we need to agitate it. So I'm going to palm roll it for a couple of seconds. And I'm going to set it to the side. I'm going to use my alcohol to clean both tops. and I'm gonna let that air dry. So I have my insulin. I'm going to pull up a total of 20 of air. Remove my top away from me. I am going to first put in 14 units of air here. Six here. I'm going to invert, and I'm going to pull down my 6 of insulin, of regular. So I have my 6. Next, I'm going to invert into the MPH, and I'm going to pull down to 20, which will give me a total of 6 of regular and 14 of MPH. I'm going to swoop here, and I'm going to allow another nurse to verify. So she's verified that this is 20 that's in here. So this is his arm. So Mr. Holmes, it's just going to be a slight pinch. I'm going to give this to you in your right arm, and I'm going to give you your Rocephin in your left arm. Clean the area, allow it to dry, pull away. It's going to be a slight pinch, so I'm going to pinch the back of the arm, and I'm going in at a 45-degree angle with my bevel up. Give the patient an insulin, release, and safety, and this goes in the sharps container. Next, I need to do my drug calculation for my Rocephin to make sure what I have is what I'm going to give. So in here, it says Rocephin 4 milligrams per milliliter. And my order also says that I need to give 4 grams per milliliter. So therefore, I'm going to draw up 1 milliliter of medication. If it was any other amount, then I would do my drug calculation and determine that amount. Next, I'm going to clean the top of the Rocephin. Allow it to dry. I'm going to pull up 1 milliliter of air because that's how much I'm giving. Pull the top away from me. On the table, inside the vial, invert. My 1 milliliter of air is in. And I'm going to pull back till I get my 1 of antibiotic, and I'm going to pull away from me. My top here, because I'm going to swoop this back in here, not to contaminate the needle. If you do contaminate the needle, you'll just unscrew this and get another fresh needle. Now I'm ready to give him his injection. So he has 1 milliliter that he's going to get. So based on the dose, I can give it in the deltoid. So, Mr. Holmes, I'm about to give you your medication in your deltoid. You may feel a slight sting as we're pushing. Is that okay with you? He said yes. So I'm going to place my hand, the palm of my hand, on the acromius process, and the back of my thumb is past the scapula. In the V shape here, I'm going to go directly in the center. So I have my area. So now I'm going to clean the area. I'm going to allow it to dry. Pull away. And I'm going to do my Z-track because I have my area that I know I'm going to do my measurements with. Based on that, I'm going to do my Z-track. All right, Mr. Holmes, you're going to feel a slight sting, and I'm going in at a 90-degree angle. Release. I don't see any blood or anything. If it was, I would just wipe with the alcohol and put a Band-Aid on it if the patient needed it. Then I will sit him up, get him back at the bed at the lowest setting, and make sure that he's comfortable. And that's the end of the checkoff.